our medical news this morning, a new government report raising concerns about the typical American diet. Ultra-processed foods still make up over half of all calories consumed in the U.S. The CDC study shows these foods are high in sodium, added sugar, and saturated fat. They've been linked to obesity, cancer, and diabetes. Experts recommend choosing whole foods as much as possible. An old drug is offering new hope in the fight against Alzheimer's. The element lithium was first approved for use as a mood stabilizer back in 1970, but it may also help brain cells stay healthy over the aging process. A new study examined how lithium affected the brain health of field mice over time. Mice with low lithium diets had higher rates of Alzheimer's-related brain conditions. New concerns about excessive screen time for children. Bradley Blackburn has more on the research showing too much time on screens could impact their heart health.
Children are spending more time on screens like phones, gaming systems, and other devices. Now new research suggests excessive screen time could be putting their heart health at risk. Dr. Celine Gounder is a CBS News medical contributor.
These researchers found that for every extra hour of screen time, there was an increased risk of obesity, high blood pressure, diabetes, even early heart disease. And this is on top of what we've seen in terms of impacts on mental health and attention span.
The study in the Journal of the American Heart Association found the link between screen time and cardiometabolic risk was strongest among kids who slept fewer hours. Dr. Amanda Marma-Perak with Lurie Children's Hospital was not involved in the research.
Another really important finding was it's actually the combination of not getting enough sleep or going to bed too late and using too many screens that can be particularly harmful. So in other words, if a kid's using a lot of screens but goes to bed early and gets plenty of sleep, that might be a little bit of a buffer against the harmful effects of screen use. Whereas if they've got both of those, then they're probably going to be even more impacted in terms of their heart health.
If cutting back on screens feels difficult, Dr. Perak says a good starting point is trying to move screen time earlier in the day and getting kids to bed earlier and to sleep longer.
As kids get older, help the child reflect on how certain types of screen use are affecting their mood and their ability to get things done and how much sleep they're getting, and help them to be a little intentional about it themselves.
And setting kids up for healthy adulthood also begins with parents modeling positive technology and digital media behavior. Bradley Blackburn, CBS News.